It's 14 November, World Diabetes Day. So I be the one that say, wetin way I feel really do for make this day a memorable one, if not of creating a video like this for create diabetes awareness for our community. Hello guys, you're welcome to my channel. Let's talk diabetes with Mira Bikono. I am a registered nurse and a diabetes educator, and my channel focuses on everything diabetes and also how to control blood sugar levels. If this is the kind of content you are interested in, make sure to subscribe to this channel and also put on your notification bell so that whenever I drop a video, you will be notified. To begin with, 14 November na a special day where it be set aside for create diabetes awareness worldwide. So in the course of this video, if you get any questions or if you get any doubts about diabetes, I go do my best for answer all questions then. Now make we take a closer look at diabetes statistics then for Flanders. Flanders na a region where it dey for Belgium. It be estimated say 500,000 people then where they dey for Flanders they get diabetes, be it diabetes type 1 or diabetes type 2. Every 17 minutes, one person it get a diagnosis say he get diabetes. 1 out of 10 Belgians it get diabetes. 37% of the population it be unaware say they get diabetes. Wetin wey e even strike me about these statistics no be about the number of people where they get the diabetes for this region. No, now the percentage for people where they be unaware say they get diabetes. 37%. That is almost half of the population. And make remember say, yeah, na a developed country. So if 37% of the population fit live with diabetes, but they don't know say they get diabetes, what about people then where they live for developing countries? What about people where they live for Cameroon? Who think say these people, the percentage for people the way they get diabetes where they live for a developing country, it be higher or it be lesser? I go one year when I thoughts them concerning this. So drop your thoughts in the comment section. My message for this diabetes awareness day now for bring them for our noticing when you get diabetes, it's not actually a death sentence. No, diabetes not be a death sentence. Actually, diabetes it not even be that bad. It only be bad now when your diabetes it don't start lead to complications. When you don't start get complications, then way it be caused by diabetes. Now for their way it be a serious problem and also a life-threatening condition. When you start get complications then like heart problems, kidney problems, eye problems, or even nerves damage where it eventually, in most cases, leads to amputation. Now for the way, now a life-threatening condition. So, which way you fit do? Now for bring your blood sugar levels under control. Now for you for bring your diabetes under control so that it no go reach for this complications stage. And how for avoid complications then for diabetes, now for follow this simple method when at the ABCD method. I go explain them which way the ABCD method it mean. And when you follow this ABCD method closely and strictly, then you will escape from getting diabetes complications. The A it stands for the A1C test, where they call and say the hemoglobin A1C. Normally, when you get diabetes, it be advisable say me your A1C it fall under 7%. Now from this A1C test, with doctor, it didn't know if you go develop complications then for diabetes. Now from this A1C test, where the doctors dem fit easily adjust your medications, whether they go stop medications or they go increase medication or they go give you different prescriptions. So when your A1C level is dey under control, the chance for you for not develop diabetes complications is high also. The B stands for blood pressure. When you get diabetes, one way for you for avoid for get diabetes complication na for you for put your blood pressure under control. Try by all possible means for see say your blood sugar levels make e no go above 13/8. Use simple methods then. Avoid for the chop salt plenty. It go help for control your blood sugar levels. We get the C. C means wetin? Cholesterol. When you be person wey you get diabetes, try for put your cholesterol under control. Now why that way you see and say people then wey they get diabetes, their treatments then it mostly involve high blood sugar medications and also cholesterol medications. All this not just for prevent these people then for get diabetes complications then. The D, it means wetin? Discipline. When you get diabetes, you get to discipline yourself. You get to discipline yourself on the kind of chop the way you dey chop am. You get to discipline yourself for the do exercises. You get to discipline yourself for the go in for your controls. You get to discipline yourself for the avoid foods the way they get too much calories. When you discipline yourself, your chances then for bring your diabetes under control they be high, where it go eventually keep you to a free diabetes complication stage. For this World Diabetes Awareness Day, I go like for make am also make it be clear for each and every one of us say all diabetes they not be the same. Yes, all diabetes are not the same. 90% for people the way they get diabetes, they get a diabetes type 2. Where it means say these people then they still produce insulin, but na just say the quantity of insulin where they produce it not be enough for take out the sugar wey it dey for their bloods. These people then they fit go in with treatment the way it not involve insulin. Just with tablets, they fit bring their diabetes under control. Why 10% of people the way they get diabetes, they get a diabetes type 1. And where the diabetes type 1, it is mostly developed now for young people. These people the way they get diabetes type 1, it means say they get insulin deficiency. Their skin, they produce insulin, where it means say they get to live with insulin all through their lives. And most often, these people they need for take insulin 4 times per day. If not, if it cause them death. Pregnancy diabetes also dey where it affect na people then wey they with belle. This diabetes it normally go away as soon as the mommy give birth to a pikin. They call and say gestational diabetes. But it shows say these people then get a higher risk for develop diabetes in a long run if they don't control their diets or if they don't live a healthy lifestyle. Then in the future, probability is high say they could get diabetes type 2. But it no mean say na all man wey get pregnancy diabetes, it go get diabetes type 2. No, if you put them under control, then you go live a diabetes-free life. We get also another kind of diabetes where they call and say neonatal diabetes. This one, it mostly affect na babies them. At times, it be confused with diabetes type 1. But for know whether na a neonatal diabetes, checkups and it be run for that pikin so that they go know if you get a diabetes type 1 or you no get a diabetes type 1. These babies then when they get a neonatal diabetes, if they discover and say they're not getting a diabetes type 1, then they actually treat them without insulin. The only person where when he get diabetes, it is compulsory for take treatment wey e be made up of insulin na person wey e get diabetes type 1. If you get pregnancy diabetes or you get diabetes type 2 or as a baby with neonatal diabetes, you fit actually manage am just with the help of tablets. On this special day also, e be very good for know say you fit reverse your diabetes. When you get diabetes, it is very possible for you for reverse your diabetes, for go to a pre-diabetes. Pre-diabetes, it means say your blood sugar levels them high, but it no qualify you for be a diabetic. Where it means say if you dey follow a healthy lifestyle, if you dey exercise, if you dey chop healthy foods then you fit easily reverse them for go for pre-diabetes stage. When you be that person where you come from a family where either your papa, your mommy, your brothers or your sisters they get diabetes, then definitely you dey run a risk for develop diabetes type 2 also. Wetin wey you fit do na say you need for the go in for constant checkups at least 3 times per year. Go in, visit your doctors, make they do you a blood checkup. With that, they go easily dictate them if you did get diabetes or not. No wait until you start see symptoms then before you rush for go consult your doctors. No. Diabetes is asymptomatic, where it means you fit still get diabetes without getting these diabetes signs then. Most often the signs themselves or the symptoms for diabetes, it is show that when the diabetes it don't really serious for your skin, and where most often it don't be too late. So no wait until you see symptoms then before you go in for checkup. No, if you come out for family with diabetes trace then they make sure at least 3 times per year you go in for checkup. Like I don't make mention, say person where he get diabetes, if you reverse a diabetes for go for pre-diabetes, now the same way with person where he get pre-diabetes, if you reverse them for go back for normal blood sugar levels. Which way you need for do now just for control your diet, control your lifestyle, live a healthy lifestyle and avoid smoking. Because smoking or drinking alcohol, now things in that way that they help for provoke diabetes also. My last message on this special day now for people the way they be so stressed up about their diabetes. For people the way their diabetes it give them headache. I get a message for them. For this group of people, wait way una fit do now for talk about una worries. Open up, talk to somebody, talk to your families, talk to your friends, talk to professionals then wey they fit help you. And when I talk of professionals, I mean people then like a diabetes educator, people then like a dietitian, people then like a psychologist, people them like a doctor. Talk to them, they go help you. They go give you advice for how to go on with diabetes stress. Also, when your diabetes it give you stress, you as a person, you fit take your diabetes for your hands. And one of the ways then for you for take your diabetes control in your hands, now for you for set goals. In the course of setting these goals, make sure say you set short-term goals. No set long-term goals. If you set long-term goals, you will easily be frustrated along the way and where you will quit on your goals. For instance, if your goal now for lose weight, make sure say you start slowly, exercise like 30 minutes per day. No just go directly for start exercise 2 hours per day. No. If you do and so, you no go fit keep am for long time. And where it will make you frustrated and disappointed. So create goals, short-term goals. Another issue also now for you for the monitor your blood sugar levels constantly. When you monitor your blood sugar levels constantly, you get a knowledge about how your blood sugar levels go. and then you go know certain foods the way you feel dey consume am and those the way you go dey avoid am. For this video, if there is one important message wey I don pass am, na for live a free complication diabetes life. And how for live this free complication life, na for you for follow the ABCD method. When you follow this ABCD method, you will eventually live a diabetes-free complication life. Remember, no be the diabetes a bad, but the complications of diabetes na it be bad and na it be life-threatening. So, bring your blood sugar levels under control for see how you go live a free complication diabetes life. I hope say this video it don't create a little bit of awareness for you, or it don't increase the knowledge where you be already get them about diabetes. If you be say you don't learn anything from this video, please give this video a thumbs up and also subscribe to this channel if you know why yet subscribe to our channel. Share this video for friends and family. By doing so, you dey help for create diabetes awareness for our community and where you dey indirectly save a life. My prayer na say any person where it dey out there, it is struggle with diabetes, make God give you a long and healthy life free with diabetes complications. Stay well. I wish you a happy Diabetes Awareness Day. Thank you for watching and have a blessed day. Bye.